Hello and welcome to the public health section for URP 475. Today we'll look at some basic public health concepts and that are essential for understanding the public health changes that are occurring in the world and look at the relationship between globalization and public health. So the main thing when we're talking about public health is the causes of death between rich and poor countries. Um, and historically, the world has suffered from what we call communicable or acute infections, things like cholera, schistosomiasis, typhoid, malaria. Although malaria is not communicable in the same way, it's vector-borne, mosquito-borne. But in any case, the things that have historically infected and killed people have been communicable in nature. That means you can get it from another human being or a vector agent like a mosquito. Um, However, in the last 50 or so odd years, with the advent of the global economy and the increase in living standards, rich countries, or rather the people in rich countries, are increasingly afflicted by things that are chronic in nature, as opposed to communicable diseases. And so, what are these chronic things? And you've heard of probably all of them: cardiovascular disease, heart disease, cancers, uh, chronic obstructive lung disease, COPD, pulmonary disease, diabetes, and related symptoms that go with that. Right? You've heard of things like hypertension, for example, or high cholesterol. All of these things are chronic in nature. They don't kill you immediately, but over time, they increase the risk for death, and they also, in many instances, also increase morbidity. So they don't only increase mortality, but they also increase morbidity. Mortality is death. Morbidity is sickness. In lower income countries, in contrast today, people are still suffering from things that are communicable in nature. They're viral in nature, bacterial, or they're pathogen vector-borne, mosquito-borne, they're parasitic, right? And here we have a list of some of these diarrheal diseases: malaria, tuberculosis. Of course, HIV and AIDS is a huge one that is in rich and poor countries, and HIV and AIDS is also communicable. The difference is that in many developing countries, HIV and AIDS is primarily a disease that is heterosexually transmitted. In many higher income countries, it is a function of MSM, or it is male to male transmission. Um, okay, let's look at child and infant mortality. Um, Both child and infant mortality, infants typically below 1 years of age, child after 1 years of age. Children and infant mortality has gone down a lot in developed or rich countries during the last 50 years. However, still remains fairly high in developing countries, countries that are poorer. And many of these are in sub-Saharan, like Africa. As you know, the statistic here points out that one of the major causes of under 5 deaths in sub-Saharan Africa is malaria, for example. So things that are impacting children and infants in developing countries are, in many instances, unheard of in developed countries. They have been eradicated or reduced to the point where they are much less of a concern, or they're not even on the public's radar screen. Here you look at causes of death in 2000 versus 2011, and it gives you sort of an indication of things that are still around. Heart disease is kind of a big one, and this chart combines rich and poor and middle income countries. Heart disease, stroke, lower respiratory infections, COPD, HIV, they're all still in the top 5. However, look what's making its way up. Are things like cancer, diabetes, and strangely enough, road injuries as well. And in some cases, this bottom part is a story of globalization. As globalization has helped poorer countries become richer, their public health, morbidity, sickness, and mortality or death patterns are starting to resemble those of developed countries, or those in richer countries. Here we disaggregate the causes of death in low-income countries, and you notice that again, things that are infectious in nature are much higher, although you still have some ischemic heart disease or heart disease, and this is primarily among those who are rich in poor countries, or the top 1% in poor countries are dying of heart disease, because the upper middle classes, upper classes in poor countries look pretty much like the average citizen or average resident of a developed country. However, HIV/AIDS, lower respiratory infection, pneumonia, for example, uh, uh, acute lower respiratory infections are still a major cause of death in poor countries, as is malaria, tuberculosis, and then other things that you've not heard of, like protein energy malnutrition, which is we'll talk about a little bit later. As you move to middle income countries that are not, countries that are not really poor, but they're not rich either, heart disease starts to make its way up. Again, strokes, right? The diseases that are chronic in nature become more important in middle income countries. That's because, again, as income goes up, lifestyle patterns change, and these lifestyle patterns, the changes in lifestyle patterns includes things like, well, fewer exercise, less exercise, more reliance on market-based foods, processed foods, and more reliance on meat. Right, meat becomes a much more staple part of your diet as you become richer. And upper middle income countries and high income countries, pretty similar. Again, heart disease, cancer, Alzheimer's is now also on the list, right? And part of this reason is that in high income countries, as opposed to, let's say, low income countries, Alzheimer's is nowhere to be seen here. In high income countries, people also live long enough for things like cancers and Alzheimer's to become more important. In countries where you have low life expectancy, right? Remember this from our demography lecture. Low life expectancy is basically, where you can't be at birth. You're not expected to live beyond, maybe 50s or 60s, right? So life expectancy at birth in the United States, for example, is around 79. In a poorer country, it might be in the 60s or even lower. So for many of these diseases to really sort of come to the forefront, like cancer or Alzheimer's, people have to kind of be old enough for them to matter. And so in richer countries, people are living longer, and so these diseases are becoming much more important. Diseases like cancer, Alzheimer's, and heart disease as well. Although heart disease seems to be a factor now in poor, middle, and rich countries, basically throughout the world. Here, this is causes of death worldwide. Again, heart disease is sort of top of this list. Okay, so why do we care about public health? Well, sort of the big thing here is that for a long time, economists, policymakers, and others interested in these kinds of questions thought that public health was something that would be taken care of as a country developed. So in other words, a lot of emphasis or focus was on making countries economically developed, and then the thinking was that as countries got richer, they would automatically address the public health problems that were existing within their borders. So public health and economic development, however, are intimately related, and causality. In other words, economic development doesn't necessarily improve public health. It usually does, but the causality actually runs the other way. That's the current thinking on this now. In other words, in many cases, the dire or abysmal state, the bad state of public health, was actually contributing to economic depression. In other words, people were dying earlier than is necessary. They were sick longer than is necessary, and because of that, they were not economically productive. So economic development was actually being impacted by public health. I mentioned here, the residents of poor countries are not only more likely to get sick, but are more likely to contract illnesses that have been eradicated in other places. We don't think about smallpox, for example. You don't think about that. And they're likely to stay sick a lot longer because they're malnourished. They don't have access to the same type of health care. And they're overall, they're things that help you recover quickly in a rich country are not as available, right? Whether it's food, medicine, access to care, or paid time off when you are sick. And a sick population is, of course, less productive. So this public health phenomena now in the last 10 to 15 years has really become important as agencies, whether it's the United Nations, World Health Organization, and countries increasingly focus on improving public health as a way of improving economic productivity. Another reason public health has become important, and this is something this has been in the news a lot in the last 5 5 to 8 years, 5 to 10 years, is that diseases have become much more international in nature, right? If you remember the swine flu, the bird flu, these things can, and Ebola most recently, a lot of fear, right, associated with this, and fear is there because these things may start wherever, but they can spread very, very quickly because we are an increasingly global population. We travel a lot. Diseases really don't know borders. They can make their way across the planet, in less than a day now. This was not possible, as recently even as 50 years ago when people traveled much less. There was much less trade, much less, travel of population across borders, whether it was for business or for work or for pleasure. But now people from every country, rich people are traveling to poor countries, poor people from poor countries are traveling to rich countries, whether it's for migration or for travel. There's just people going in every direction. And this is, this sort of the story of globalization. Globalization has really increased human traffic and the flow of goods across borders, and of course with it, diseases. So what are the functions of public health? Here I mentioned sort of a list of them. Surveillance, keeping track of diseases, basically, like what is exactly going on and in what part of the world. Keep track of and here these are the words we'll look at in a bit, or we can look at them right now. Keep track of the incidence and prevalence of diseases. So here, if you go to the public health lists, you notice incidence is the number of new cases in a given time period, and prevalence is the proportion with a given condition at a particular point in time. So incidence basically is concerned with, how many, is there an increase or decrease in the number of new cases of a particular condition or a particular disease in a specific time period in a particular region. So we could, for example, say the incidence of HIV and AIDS in the United States in 2014 was blah, 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 whatever it was. Prevalence, on the other hand, is the number of people who have a particular condition in a given place in a given time period, divided by, and this is the prevalence rate, divided by the number of people who could have had the condition. So the prevalence of HIV and AIDS in 2014 in the US would be the number of people who have HIV and AIDS in the US divided by the number of people who could have had HIV and AIDS, and that is the total population. Everybody theoretically could have had HIV and AIDS. Okay, so you divide the number of people who have it by the number of people who could have had it, and you get a prevalence rate. Incidence is basically the number of new cases, and in some cases, if you want an incidence rate, you divide the incidence or the number of new cases divided by the total number of people who could have gotten that. So again, the incidence rate for HIV and AIDS would be, for example, the incidence rate in 2014 in U.S. could be calculated by dividing the number of people who contracted HIV and AIDS or rather HIV, because AIDS is a disease version of HIV. It's when HIV progresses to it's what we call its disease form, it becomes AIDS. So the incidence rate for HIV would be the number of people who have HIV in 2014 in the US who got it in 2014 divided by the number of people who could have gotten it. So theoretically, again, everybody could have gotten it, right? So incidence is a little bit different than prevalence, and I wanted to cover that. The other two important concepts I mentioned earlier, mortality. Mortality deals with death. So basically, the number of people who died, let's say, in the US in 2014, divided by the number of people who could have died. Everybody could have theoretically died, right? In the US, so you divide the number of people who died in 2014 by the number of people who could have died, you get the mortality rate. And we call this all-cause mortality because we're not disaggregating or separating by deaths due to specific conditions or diseases. Morbidity is sickness. So the morbidity, when we say the morbidity burden associated with the disease, what we're talking about really is how long somebody has been sick, the duration, and how sick they have been, the intensity of the sickness. We want to, so like for example, when you get, and the flu has been in the news a lot lately, you get the flu, and it's been kind of scary because of the number of deaths, right? The mortality associated with flu has been scary. The morbidity has also been scary, and doctors want to reduce the morbidity. That is, if you get the flu, typically you have 2 to 3 days that are really bad, and you start to recover within a week. That's at least the typical progression. Now, if you're in a developing country, you might get influenza, and you might be sick for 1 week or 2 weeks, and so the duration of your sickness would be longer, and you might feel sick for a lot longer. The intensity might be longer as well. So we say the morbidity associated with flu in a developing country would be pretty high. Okay, coming back here to the other functions of public health, epidemiology also is an important function. What is epidemiology? Epidemiology is concerned with basically tracking the origin of a particular disease or a condition, and how it has spread. So sometimes you'll hear just recently in the news there was talk of HIV and syphilis cluster in, I think it was Milwaukee. So epidemiologists from CDC, for example, are probably working on this right now, trying to basically figure out why there is such a explosion in the incidence of HIV and syphilis in Milwaukee. Epidemiologists, why? Because they want to see where it's coming from and how to stop it. The best way to actually treat health conditions, disease, is to actually prevent it from spreading. You see, once you have it, it's a lot more expensive to treat it. So prevention really is, again, as the proverb goes, the best medicine. Another function of public health is health education. The anti-smoking campaign is an example of that. More recently, emergency preparedness, whether it's to earthquakes, tsunamis, or even terrorist events, has become more important. So public health is about emergency preparedness. And things that you don't hear about are like program planning, implementation, and evaluation. For example, health departments across the country, and in the United States, public health departments are typically organized at the county level. So unless you're a really big city like the city of Los Angeles or Long Beach or Pasadena, they have their individual health departments. But typically, smaller cities rely on LA County, Los Angeles County Department of Health and Human Services, Orange County Department of Health and Human Services for public health services. And these departments do all of these functions: surveillance, epidemiology, health education, emergency preparedness, and they also do a lot of this through program planning. They have public health specialists who plan programs around each of these areas and implement them. And then one of the key things is to see if these programs are actually working. For example, you might have a health education program that aims to increase, the number of fruits and vegetables people are consuming, let's say in Los Angeles County. Well, how do you know this program is working? This health education is working. So you have to have an evaluation component of it as well. Another thing that's not kind of mentioned here, but health departments do in Southern California and in California, is you go to the restaurants and you see those A, B, C, D, right? It's usually A, B, C. Most people after the CSC kind of get the idea that the restaurant is not really up to par as far as public health is concerned. But the public health departments rate restaurants in their jurisdiction, right? A, B, C, and you see these, and so this is to give the general public, some indication as to the level of sanitation, the adherence to code, basically, within these restaurants. And so restaurants typically want to get an A because they want to give the public confidence that it's okay to eat there. Okay, public health departments also provide health services, direct health services like immunizations, mass immunizations, for example. In the case of some kind of disaster, they might provide other health services as well. And throughout all of these services is data collection. They're always collecting data: who got where, how long were they sick, how did it spread, and then they analyze the data and they disseminate it among other public health, government agencies, and the general public as is necessary to prevent the disease from spreading further, or to educate the public, or basically to treat the disease to reduce its severity or spread. So here I talk about also some of the basic ways of, and earlier I discussed, what prevalence incidence means. And so in the rest of the slides, I give you basically a way of calculating some of these measures. So, rates, for example. How do you calculate rate? The key thing here, remember, rates are always expressed in terms of like a percentage, a decimal. So mortality rate would be number of deaths divided by total population, right? Infant mortality rate, number of infants that's below 1 who have died in a particular area, divided by total number of live births, total number of infants who have been born in that area. This K thing that we're talking about, basically sometimes, for example, the total population of the U.S. is around 325 million. If you divide the number of deaths by the total population, you're going to get a very small decimal. And that decimal doesn't always make sense. It might be like 0.0000, and I'm making this number up. It might be, like 4 or 5 zeros followed by some numbers. If you multiply that by, let's say, 100,000 or a million, basically this gives you the ability to say, oh, for every 1 million people in the U.S., 2 have died last year, or for every 1 million people in the U.S., one got this particular disease. That statistic is a lot easier for people to understand than a decimal, right? So this K is basically the thing that we multiply this decimal by. Some more examples of morbidity, mortality, prevalence, and you can read these. Another important thing that type of health condition that we like to sort of track. So earlier I talked about communicable diseases, acute infections, parasitic infections, things that you can get from other people or animals, as well as chronic conditions like diabetes, cancer, Alzheimer's. But something that we don't often talk about is micro and macronutrient deficiencies. And what these and macronutrient deficiencies basically deal with the deficiencies that occur because you are not eating either enough food, which would be protein energy malnutrition, or you're eating the wrong kinds of food. And these often result in micronutrient deficiencies. Micronutrient deficiencies occur, for example, or rather, the 5-a-day message that you sometimes hear, eat enough servings of fruits and vegetables, for example, eat 5 servings of fruits and vegetables per day. Are so you get all your micronutrients, vitamins, minerals from fruits and vegetables. And it's better to get these actually straight from the source as opposed to in a pill. The evidence that multivitamins actually work in the long term is kind of mixed. So anyway, each year many people in developing countries die from starvation, malnutrition, and related causes. And as we'll see in the food lecture, and this is rather tragic because this happens even though we produce enough food in the planet to feed everybody, but it's not distributed properly. So they have macronutrient deficiencies as a result of that. Now, strangely, in the United States, you can get enough calories from, let's say, protein and fat and carbohydrates, but if you're not eating enough fruits and vegetables, you can still be malnourished from a micronutrient point of view. And this is, in fact, what happens in many instances that people in the United States, particularly those that have a diet that is very heavy in carbohydrates, fats, or animal protein, for example, are not getting enough vitamins and minerals. So public health is also very much concerned about this. And in the other slides, I talk a little bit about what these micronutrient deficiencies are. Vitamin A, iodine. These don't really exist as much here in the United States, but iodine, for example, deficiency does not exist because we put iodine in our salt, right? We've supplemented our salt for iodine. Vitamin A deficiency, severe vitamin A deficiency can result in something called night blindness, for example. Women in even the U.S. are given iron supplementation because they're, especially during pregnancy, because they're much more susceptible to iron deficiency anemia, right? And iron is essential for transporting oxygen in your blood. In developing countries and poorer countries, we are very concerned with protein and energy malnutrition. And of these there are two types, Marasmus and Kwashiorkor, and I discussed these here. Give you an example right here, and you've seen sort of these, unfortunately, these images sometimes in television of particularly children who are malnourished this way. So this still exists in developing countries. Often many children in developing countries are born low birth weight, that's below 5.5 pounds. And primary reason in developing countries that babies are born below 5.5 pounds or 2,500 grams is that they are what we call intrauterine growth retarded. In other words, they go through the full 9 months of gestation. Gestation is, the duration of the pregnancy, but they're still born below weight. And this is because mothers who are giving birth to these children are usually low weight, or these mothers don't get enough food, right? Babies, where do they come from? They come from food. I mean, it's kind of weird to think of it that way, but a child basically is, the food that a mom consumes reassembled into a human being. Kind of funny to think of it that way. But so when women are not getting enough nutrition, babies are born low birth weight. And what we know about low birth weight babies that are IUGR, you can also be low birth weight, by the way, if you're born premature. But that's just because you're born below 5.5 pounds because you didn't stay the full 9 months. That's actually not as bad as going the full 9 months and then being born low birth weight, and that is IUGR. And in many cases, IUGR babies are developmentally compromised, so they basically will not be, for example, as cognitively developed, and they'll have other health conditions that prevent them from becoming fully productive human beings as they get older. So addressing low birth weight is of prime importance in developing countries. Anthropometry is one of the ways we measure actually proper development. The one you're familiar with is probably body mass index, and I give you a definition here: weight for height. But there are other indicators too. And as kids, in the United States, as when they're born, and pediatricians track them over time, we take their weight for age, weight for height, height for age, those kinds of things. So again, from a globalization standpoint, why is it important to address public health problems? Well, it's because countries, as poor countries, their development trajectories, their development capacities are significantly compromised when you have significant public health problems. So it's imperative that not only reduce the mortality burdens in these developing countries, but also the sickness burdens. We also reduce the number of low birth weight babies and the number of malnutrition, right? Macronutrient deficiencies, and reduce basically the overall global disease burden that is associated with things that are actually easily preventable and or treatable. And a lot of this comes from better sanitation, hygiene, and management of water resources, and better provision or distribution of food throughout the planet. And this is what we would call primary public health prevention, or primary health care. And why is primary health care important? Because it is about preventing things from actually happening. Because once things happen, sometimes you can't cure them. And curing something is a lot more difficult than preventing it. And then the worst case is and unfortunately, the medical model in the United States is primarily focused around this type of, or this stage of public health, which is tertiary. Tertiary health management basically seeks to reduce the impact or decrease disability of slow progression or manage the disease, as with chronic health conditions, diabetes, hypertension, or cancers and HIV. Now, HIV and cancers, unfortunately, are of a nature where you can't cure them. Cancer sometimes go into remission, but you have to be constantly vigilant. HIV, you have to manage for your whole life. Although treatment is to the point now where life expectancy for those with HIV, if properly managed, it can be close to normal. But these things like diabetes are completely preventable through primary. However, in the United States, the approach we've taken is much more management, and part of this is because it's much easier to take a pill than actually eat better or exercise. But the other part has everything to do with our global capital economy, because there's a lot of money to be made, and this is a key point. There's a lot of money to be made in treating these diseases, right? Think of big pharmacological companies. A lot of money to be made by making a pill for better diabetes management, for better hypertension management, as opposed to prevent the population from getting these in the first place. If the population all of a sudden in the United States just started eating better, and the incidence of overweight and obesity went down, if the prevalence of overweight and obesity went down, you would have much less diabetes, hypertension, cardiovascular incidents, and the like. That would impact the drug industry, would it not? So anyway, in many cases, globalization has increased the food supply, making more food available, but in a weird way, it has also reduced the amount of food, good foods that are available. It has tended to focus, and we'll look at this when we look at the food lecture a bit more, but it has tended to privilege certain types of foods that are more starchy in nature. It has tended to privilege certain types, or corn, like in the United States. It has started to privilege the animal industry, right? People's tastes have changed to meat, and so we have the rise of basically animal factory farming, and this has been very, very bad, not just for our waistlines, but also for the environment. But it has been a boon in many ways boon meaning it's been positive in many ways for pharmacological companies that make a lot of money making medicines for diabetes, heart disease, and so on. Okay, I'm going to stop there. And next we will look at food energy, and water. The sort of the other big things that have been impacted by a globalizing economy.